Yeah, so it's recording now. So once again, my name is Galia Himek. I'm convener of the Development Studies Association Ireland Civil Society Study Group, and I have the pleasure to be chairing this webinar. I will just briefly introduce our speakers, and then Dr. Susan Murphy from Trinity College Dublin will kick off the discussion, and we'll end with a general discussion. Of course, the Q&A option is enabled, but if you like, you may put your questions in the chat for all of us to see. So I would like to start now. I'll share the screen. Sorry, let me just, okay, this one should be yours, yeah. So I would like to start by letting our first speaker, Philip Farrow from GO, who is the Global Accountability Advisor, currently based in Washington. He has been with GO since 2016, and prior to that, he has also worked in Bosnia and Herzegovina and also for the American Red Cross. So Philip, the floor is yours.
Thank you, Galia. And thank you to my co-panelists and to Susan and to the Civil Society Group for this opportunity today. We were saying earlier on the call, before the call officially started, that certainly I feel that opportunities like this to discuss accountability to affected populations are not as common as they should be. Webinars on this theme, sessions on this theme certainly seem to be a little bit rarer than I'd like. So I'm really pleased that not only are we doing this, but we also that to be participating as well. It's a great opportunity, and at GO, we're always happy to speak to our accountability work, because it's something that we've been putting about 10 years into now with a sort of large degree of focus. So yeah, I'm very pleased to be here today, and I think my email will be at the end. If anyone wants to get in touch with me, I'm more than happy to share any insights, or if you have anything you'd like to share with me, I'm always happy to learn. So I have 15 minutes, and Galia, I know, will tell me if I'm running over, because I do have the tendency to blab on about this topic, so I'll try my best. I just want to say a little bit about GO, first of all, for anyone on the call who's not very aware of the organization. We're 44 years old this year. We were founded in July of 1977. And our head office is in Dunleary, which is just south of Dublin in Ireland. We are in 14 country programs at the moment, I believe, in terms of operations. Those being in Latin America, the Caribbean, I think 3 countries in the Middle East region, and then with a number, I think a pair in West Africa, some in East Africa and Southeast Africa. We have been in over 60 countries since our founding, and have been responding to, I think, pretty much almost every major humanitarian crisis that has come up in the last 4 decades. Additionally to that, though, as well as being a humanitarian agency, we are a developmental organization, and we do believe in assisting communities with long-term recovery to shocks and long-term development. As well as those 14 countries, we also have offices in London, and then one in Washington, DC, where I am based. So next slide, please, Galia. So talking about AAP at GO, a little bit of a background, I guess, before I talk about how it's operationalized, which is obviously the theme of this. GO in 2011, which is 10 years ago now, made this grand commitment to accountability as part of our 2012-2016 strategy. And as part of that, the position which I now hold as Global Accountability Advisor was set up. We also had that year our first community feedback mechanism, which was set up in our Haiti program. I think the very first feedback mechanism we set up was before my time, but was a suggestion box on a desk. And it's, I think, certainly become a lot more sophisticated since then, although there's, a good old-fashioned suggestion box on a desk is still very much part of our framework. And we, in that time then, sort of immediately after that point, we joined the ALNAP network, the Accountability and Learning Network, in 2012. We also became founding members of this Core Humanitarian Standards Alliance in the same year. And we also it was at that point that we developed global toolkits and guidelines around accountability to affected populations themes, including the community feedback mechanism and also community information sharing guidelines and beneficiary verification and selection guidelines. In that time, we have brought online a community feedback mechanism in all 14 of our country programs, as well as a few country programs that are no longer active. And as I said, it's become a far more sophisticated, well-rounded system. We are working off a framework that we developed in 2011, and we're currently working with Trinity College of Dublin, as Susan would know, on a project to develop an accountability, or hopefully to develop something around, or the foundation even, to an accountability framework moving forward. So a new accountability to affected populations framework this year. I think when accountability to affected populations really kicked off at Goal, you know, accountability sits in most of our country programs and globally under the meal umbrella, apart from in our Goal Syria program, which you're going to see as we go along has a much more sort of robust accountability or larger accountability component, where accountability in our Syria program is an independent department with its own coordinator. In our other country programs, it still sits in the meal function, but when back in 2011, it was really accountability had focal persons who had other main jobs. And now in most of our country programs, we do have accountability managers or officers and people with dedicated positions to AAP in all 14 of our country programs. Next slide, please, Galia. So I'll start off by talking about the CFM. I think, you know, obviously, we shouldn't always think of accountability to affected populations as just being feedback mechanisms. I think that there's a lot more that we can do in terms of information sharing guidelines, and I think that the level of thought around that is getting better and better. Also, in terms of interlinking with things like safeguarding and inclusion around safe and accountable programming, and then also around, you know, program participant selection, which often falls under accountability. But our CFM, as we call it, the community feedback mechanism, is the cornerstone of accountability to affected populations at Goal. As I said, we've had one since 2011 in Haiti. It used to be called the CRM, the Complaints Response Mechanism. We took a turn away from that title a couple of years ago for two reasons. One, because we wanted to make sure the mechanism was fully community facing and not just, you know, intended, or not just seen as being intended for direct beneficiaries of our programs. You know, if we do our work well, the net effect of our programs should be ripple affected across the communities that we work in. We have direct beneficiaries, indirect beneficiaries, the community benefits. There are stakeholders across multiple levels of the community. So we really wanted to make sure that this is a mechanism that is seen as being something for all stakeholders in the community. And in fact, globally, most of our communicants of our CFM are not actually active beneficiaries. So that was one important change that we wanted to make. The other thing was to move away from an overemphasis on the word complaints, more to feedback. This is not shying away from complaints in any way. Complaints are incredibly important in terms of helping us not only spot any wrongdoing that might be taking place, and in particular any serious wrongdoing, but also it helps us improve our program quality and the effectiveness and relevance of the work we do. But we found that an overemphasis on complaints meant that it was a bit misleading in terms of what the mechanism was for. While we do welcome and encourage complaining, we want feedback as well. We want suggestions. We also want people to come and ask us questions and request assistance, because we feel all of these things are an important part of exercising accountability to the populations that we work with. So we changed to the community feedback mechanism. That's the latest name that we have. It was changed last year through a thorough consultation internally and some desk research externally. That is translated, by the way, the term CFM into the operational languages in country programs, and that was also a consideration. Our CFM globally in 14 countries operates in 21 different languages, and I'll get to the theme of languages in a little while. One of the main themes, I think, of our CFM, and one of the things that we find helps it work best is that it is localized and contextualized as much as possible. While we do have global guidelines and global standards that we always try to adhere to, and the standards we always aim to adhere to, of course, the guidelines themselves, the standard operating procedures, How the CFM is specifically operationalized, we generally leave up to the country program to determine, because we find that this mechanism, maybe more than anything else that we do, has to be as contextualized as possible. It has to be as relevant as possible to the community that it aims to serve. So therefore, in terms of the communication channels, the languages that it uses, how it's advertised, these are things that while we have best practice standards, these are things that our country programs take the lead on. And just to say then, like, any achievements I talk about today are going to be due to our country programs and not to me. So just credit be where it's due there. We advertise ICFM, as I said, quite heavily. It is advertised in the form of posters, in the form of pamphlets, in the form of information cards. In some country contexts, it's even advertised on the radio and on social media. And when we carry out assessments, particularly accountability assessments, but also more general meal assessments, the public awareness of the CFM through that advertisement is always important. Thank you. And in 2020, we had 173,000 communications, which is quite large, but I'm going to get to that in a second. Next slide, please, Galia. Numbers aren't everything, just to say, you know, a CFM has to be judged by how accessible it is, how aware the public are of it, and also how efficient it is. That, you know, there is a systematized way for the information that we're getting to help improve program quality. But certainly large numbers are good because they show that it's well advertised and that the community is engaged. You can see there that Syria dominates, and there's a lot of reasons which I'm not necessarily going to go into that are often to do with the context that we work in Goals Syria. But it's important to note that outside of Syria, our CFM has grown by a factor of 5 in the last 3 years, and continues to grow as it becomes more embedded in the community and more established and more advertised. Next slide, please, Galia. You know, this goes, I think, to the point about participation and program quality that I mentioned. You know, our recommendation is that, you know, feedback that comes into the CFM should never be ad hoc shared with programs teams, should never be just shared as it comes in, but there has to be a systematized way for sharing both, you know, CFM data and other data that comes in from M&E functions with programs teams and with the teams who are necessary to implement any changes from it. You know, an example I like to share from one of our country programs was, they're very simple things that help improve program quality. We had a lot of complaints all of a sudden one quarter about the quality of tuna that we were giving with our food kits. We analyzed the tuna. There was nothing wrong with it from I suppose you could say a scientific point of view, but nonetheless, the community didn't like it. And this was something we were seeing both in our CFM and from our M&E data. You take that information, you analyze it, you share it with the programs team, and they effected a change whereby we switched from tuna to sardines, and all of a sudden we had no more complaints about the quality of canned fish in the kits. Very simple examples. We've had people, you know, tell us that the distribution site is not very accessible for women in the community. Obviously, our distribution sites are heavily analyzed beforehand, but this was very interesting feedback that we took. Thank you, Galia, and decided to make a change and change our distribution site based on that. So it's closing that feedback loop, you know, making sure that what we're getting from communities, we're not just dumping somewhere, that it is actually going to affect positive change in our programs. Next slide, please. I'll touch on safeguarding accessibility and inclusion here. We are increasingly thinking around, and you know, it's something recommended, and I think donors are thinking around this, the sort of where accountability to affected populations, safeguarding and inclusion overlap, and this is something sort of somewhat an emergent body of thinking that we're definitely taking on a goal. As I said, our CFM is in 21 different languages, and we also are always looking into how we advertise the CFM. Is it too wordy? Is there too much text? How can people with low literacy levels learn about it? And how accessible is it to people with different needs? You know, is it just a desk in an office populated completely by men? Is it accessible to people who live very, very far away? And we've had challenges, you know, we're not perfect. We've had challenges with youth. I think globally, youth, people under the age of 18 represent less than 2% of our users of our CFM. And that's something that we're constantly working on trying to improve on. Next slide, please. Just to say that, you know, Syria, you know, it dominates our CFM, but we don't allow it to dominate the narrative. If we include Syria, you know, we see that men are major users of our CFM. They're 80% of our users. And we're doing a lot of work in Syria on trying to bridge that gap with females in the community. But outside of Syria, women are actually the dominant group of 55%, which actually reflects almost exactly the number of, the proportion of our beneficiaries who are female and male, which I think is very interesting that they align up quite cleanly. But it's just to show that, numbers aren't everything. And certainly it's that localized, contextualized thing where our CFMs are all separate, and we don't want other CFMs to be led by a narrative of another one. Next slide, please. Just to lastly say, then I'm just going to talk about COVID-19, that the challenges that it presented for us were huge. The CFM relies on, accountability to affected populations relies heavily on communication. And often people like face-to-face communication. That was curtailed strongly in 2020. So a lot of work was gone into making sure our CFMs, where they were still operational in terms of face-to-face communication, were safe and sanitized. We also learned very strongly that the remote means of communication we had put in place prior to COVID became incredibly useful. And this was an unintended benefit in that prior to COVID, and you can go to the next slide here, Galia, if you don't mind. Prior to COVID, most people liked to come and talk to us in person at desks, talking to staff in the field. A minority used our WhatsApp and email and hotline channels. In Q2 of 2020, that completely flipped and continues to become stronger in the fact that people are starting to use email and WhatsApp and our free hotlines that we have in all of our CFMs to get in touch with us. This isn't perfect though, because a lot of people don't have access to WhatsApp, don't have access to email, may not have phone data. So we're constantly working on trying to find the best means of remote communication we can get to people who can't come in touch with us in person. And then the last slide, next, Galia, is just the last thing is just to say that, COVID-19 presented, these are COVID-19 specific communications in 2020. And it was interesting in Syria, for example, we had very few COVID-19 related communications, but in Turkey and Ethiopia, we had a large amount proportionally. So in different contexts, in different places, people were coming to the CFM to ask questions about COVID and share misinformation that was going around in the community. And we're hoping to kind of learn from that at some point when we feel we're out of the woods. So that's the end from me, and I just want to thank you for letting me share some little points and lessons that we've had around AAP at Go. Thank you.
Thank you very much. Thank you very much, Phil. And now, okay, I would like to now introduce our second speaker, the head of the Humanitarian Aid Program of the Polish Medical Mission. Małgorzata Oleszyńska-Czart has been in the sector for 17 years now, and she's currently responsible for humanitarian assistance in Syria, Venezuela, and Colombia. And the floor is yours, Małgorzata.
Thank you very much. May I have the next slide, please? Yes. Just short introduction of our NGO. It was voluntary-based organization for over 20 years, created by medical staff in Poland as the reaction for the Balkan War, specifically in Kosovo. Till 2015, it was created only by volunteers, and PMM didn't have any employed person, but we started to develop very quickly, and from the last 5-6 years, we just became, I think, the third biggest NGO working in humanitarian aid in Poland. So we were working in several countries, over 30 countries on all continents of the world, providing medical assistance, primary healthcare services, and rescuing life of mainly women and children that are our core beneficiaries. Our projects had value of €5 billion, mainly on humanitarian and development aid. And we may be proud that we improved the quality and dignity of life of over 1 billion beneficiaries within the last 20 years, mainly in the most affected populations of the world in the Middle East, in Africa and Asia. Thank you, the next one. We have 4 core programs that we are still performing. That's medical assistance for mothers and newborns, actually working with our staff in Jordan, Iraq, and Tanzania. We fight against hunger and malnutrition in Venezuela, Zambia, and Senegal when we have long-term projects. We are providing specialist medical care in Myanmar, Malawi, Zambia, also in Syria when we are financing prostheses for children and women with amputated limbs. And we do emergency response. That was our very first activity now in Syria and, for example, in Lebanon, that happened last year. Within accountability to affected populations, we do have core principles that are applying to all our activities. It's participation and inclusion. We do not leave anyone behind. We do include all members of the communities we are helping in. Of course, women, of course, girls, disabled person, elderly people. That's our core principle. We communicate with transparency. We have procedures and politics on place that are allowing us to show our transparency procedures to our beneficiaries, and we are always asking for clear communication to us, and then we are trying to have the good feedback loop after we are getting the information. So our feedback and response are based on communication with our beneficiaries and the information we are getting, and our response. And the last principle is organizational learning and adaptation. So it is lessons learned that we have from our actions. We are integrating accountability to affected populations mechanism to our whole programs. It is very important for us, since we have all politics on place for last 6 years, that we could show to our beneficiaries and to our partners in the locations when we are working that we do care of the populations that we are working with, and we respect the rights, and we are including everyone to our aid programs. We are trying to avoid duplicating efforts in order to make communication initiatives sustainable, and we are building on staff capacities and to work with services that are already active. So if our partner in Syria, Jordan, Iraq, Senegal, or Tanzania has already some procedures and capacities to implement AAP in the program, then we are basing on that. If we do see any gaps, we are trying to improve the communication, improve the procedures in terms to have AAP working better. We ensure that all persons concerned have equal and non-discriminatory access to protection. It is very important for us that we have the information from the field how to protect and how to assist all members of the community we are working with. Because very often our actions are taking place in completely different culture, religious or tradition context, and we have to get the knowledge, and we have to learn, and we have to ensure that according to these rules that are there on place, everybody has the access to protection and assistance from us. We are using transparent communication channels. It means that we are listening to the population, we are listening to our partner, and we are giving the feedback and also communicating with our staff in the headquarters. And it means that we are collecting and integrating the feedback we are getting. We are allocating human and financial resources to ensure that feedback from the persons of concern is systematically collected. For example, from the Syrian refugees in the camps, or from poor community women far from our hospital and medical assistance. We have to ensure that feedback is knowledge is assessed and is referred and responded to in a timely, confidential, and effective manner. So it is very important for us that we react as quick as it is possible, getting information from the field, and we are communicating with our partner how to to give the feedback to be effective, but also confidential regarding the protection of our beneficiaries. That means that our collaboration with our partners in the field that are mainly local organizations is very effective, and it's basing on the real data. And we could include all those data and information and knowledge to our response processes wherever it is appropriate. We are also sharing information, and we are communicating in languages, formats, and media that are culturally appropriate for. That's what my colleague has said the same in the former presentation, because we are working in the territories when people are mainly speaking the local languages. They do have their own structure regarding the governance, local governance, and we have to respect that, and we have to take it to the account in our feedback and sharing the information. And we have to ensure that our information and feedback is accessible to all groups in the community. We are protecting our data, and we are applying organizational learning like interventions, planning, priority settings, course directions. Yes, I just want to show 3 slides regarding our programs. May I have the next slide, please? Having the 3 years project in Tanzania, we learned from our outreach team that was working with as the mobile clinic for pregnant women and children, but also collecting data regarding GBV in the region, that there is a huge problem with gender-based violence in Lynn region. And basing on that communication that was clearly presented to us by the social worker that was a part of the outreach team, we created GBV and the gender policy, and included also the trainings into our next year program in that region, and it is just happening now. So we learned last year and we implemented that year. It was very quick. It was very quick action, and now we have integrated medical care and also GBV prevention in the region that was not on place before. The next slide, please. In Iraqi Kurdistan, for last 5 years, we are providing primary health care to refugees and internally displaced population in the camps, recently in the Erbil Governorate. And together with our partner, we implemented AAP measures, because we have to remember that vast of our beneficiaries, they have lack of literacy, and they cannot read neither write. So we have to ensure that all population has the access to communication with us and to complain and to pass the information. So we have complaint boxes. We can, the people that do not write, they could go to our local protection officer. They can contact social mobilizers that are also the part of the camp families. So they are well known to our beneficiaries. We have the trainer session on how to implement the complaint system, and also, yeah, we always recently are including information about COVID, and basing on that, we are performing midterm and final evaluations that are helping us to plan better, also with AAP measures. So we are trying to involve everyone, the adults, but also the teenagers that are giving us feedback on complaints. Yeah. The next slide, please. In Zarqa in Jordan, where we have the health center for local women, Jordanese poor women and Syrian refugee women, We have collaboration with Soldiers Family Welfare Society that was created by Suhad Ahmad Mustafa. And Suhad is a woman who first implemented in Amman, in Amman province, gender-based violence prevention. And she's working for the last 30 years for inclusion and protection of women. And here in Jordan, we are learning from her and her organization how to include and how to protect local women and Syrian refugee women from domestic violence, and also how to involve them into activity that are empowering their situation there. So they are involved in vocational training, they have their own little agriculture factory when they can have crops, and in winter they are sewing some winter presents that they are selling, and in that way we are including them, we are empowering women, and we are protecting them because they bring incomes to the family. So it is important for them that they have the value that also is respected by the other family members. Yes, and the last.
Yeah.
So our call to action is to join collaboration of humanitarian and development aid organizations to share findings, results, and tools, to liaise with clusters to coordinate capacity building activities, including AAP, because it's not very often when we met this kind of activity from the clusters on AAP. And following that, exchange good practices, ensuring that awareness raising and capacity building amongst partners is raising and improving within every program. Of course, there are many challenges regarding this part that we can say that is still many questions to be answered. Of course, we have to manage the expectation. We have challenges by counting the time spent on consultations versus time spent on implementation. We are thinking that sometimes we expose affected people to psychological burden by carrying the detailed assessments, but nevertheless, the goal is one, to improve AAP, to include and to protect. So I will be very happy to exchange good practices with my colleagues from Ireland and Poland as well. Thank you very much.
Thank you very much, Małgorzata. And now, Lilia, you should be able to share your screen. And I would like to introduce our third speaker, Lilia Iwaszczenko from the Polish Humanitarian Action. She's the Global Monitoring, Evaluation, Accountability and Learning Manager with Polish Humanitarian Action, and she has 5 years of hands-on experience in this area. So Lilia, the floor is yours.
Thank you, Gala, for introduction. Yes, my name is Lilia and I'm Global New Manager in Polish Humanitarian Action. And today I will talk about the lessons learned from the implementation of the AAP approaches, accountability to affected populations approaches in PH operations in different countries such as Ukraine, Somalia, Iraq, and Yemen. I'll start my presentation with a short introduction, also some facts about the history of the organization, and then we will move on to the practical lessons learned from the design, implementation, and monitoring of the complaints and feedback response mechanism. It will be the main focus of my presentation today. And I will also briefly talk about some innovative approaches that we implemented to community engagement and information sharing during the COVID-19 pandemic, because definitely this is the biggest challenge for our operations now. Okay, so Polish Humanitarian Action was established on the 26th of December in 1992, when Janina Hojska, the president of the foundation, started initiated organizing convoys with some donations from the Polish society to the affected populations of Sarajevo. It was actually the first initiative of this kind to allow the Polish society to contribute to alleviating the humanitarian needs of the affected people affected as a result of the war. So since December 1994, Polish Humanitarian Action is operating under the current name and it has provided the humanitarian assistance in 44 countries around the world. In nearly 30 years, Polish Humanitarian Action has become one of the largest and most active NGOs based out of Central Europe. And currently, we are providing humanitarian and development projects in the sectors of WASH, FSL, protection, education, shelter, in hard-to-reach areas in the countries of Somalia, South Sudan, Ukraine, Iraq, and Yemen. And attention that is given to the downward accountability, which means accountability to the people affected by crisis, is central in what Polish Humanitarian Action does in all the countries. And when designing, implementing, and monitoring and evaluation our projects, AAP mechanisms are in the core. We are also committed to using the international standards and good practices, such as interagency standing committee commitments on AAP and DSAI, also for humanitarian standard on the quality and the accountability. But apart from that, we are constantly drawing on the practical lessons learned from our operations, because it's not always easy to follow solely the standards. We should be adaptable according to the context, according to some challenges and current situation in the countries of the operation. So today I will mainly talk about our practical lessons learned from operationalizing such AAP mechanisms as complaints and feedback response mechanism, also community engagement and information sharing in PH operations. First of all, I would like to say that one of the most common mistakes that we can make is to think that just because our organization does not receive any complaint, we have completely satisfied project participants or affected population. It is possible when you receive an avalanche of positive feedbacks or some compliments and only a few complaints, but otherwise you should look into the reasons why the complaints and feedbacks are not coming. So the most common reasons are that the project participants or community members may not feel empowered to share their complaints, or they may not understand how the system works, or they may not know, they may have experienced the lack of information about the system, or they may not feel also empowered enough to complain, and they will fear to lose the aid or to harm their relationship with their organization. So how to, that's why it is essential to create an environment that solicits feedback and complaints and communication from the affected population, starting from the initial design of the AAP system. And that will be in focus of the first examples of our lessons learned, of our experiential learning from the operations. So the first group is community engagement in the initial design of the complaints and feedback response mechanism is essential. I'll first like to start with the example from our mission in Somalia. This is the oldest mission in PH that was established in 2011. And the initial design of the system was based on the international standards, but it was not based on the community consultation. So in 2020, MIL team realized that there is a need to review the system. And first of all, the first action was to engage with the community through a series of consultations and focus group discussions. During these consultations, it was found that while some community members would prefer calling the hotline with the communication, information request, or sharing their feedback and complaints, other community members would just prefer face-to-face. Also, the need for having a community-based complaints committee was identified. So it proved that in the same community, there might be different preferences and different needs. So based on the results of these consultations, the complaints and feedback response mechanism and in general the accountability system was revised and improved to meet the needs and preferences of the affected populations better. So we realized that it's never late to make a change, because the adaptation is pretty much needed. It was already stressed in other presentations that adaptation to the contents and to the dynamic environment is needed. It will be also illustrated by the next example from a PH mission in Ukraine. keeping fingers on the pulse. Why it is so? There is a practice in this mission that was established in 2015 to assess the beneficiary's preference as well as awareness about the accountability mechanisms on a very regular level. For example, the questions related to AAP are included in all baseline and endline studies that are conducted in all projects implemented in the mission. These questions are integral parts of the surveys, household surveys, focus group discussions, key informant interviews. This data is regularly used to adapt complaints and feedback response mechanisms and other accountability mechanisms in the mission. For example, in the most recent endline study, we identified that 48% of the beneficiaries would prefer still to speak directly to PH staff. Despite all the challenges of the work in the COVID-19 context and the need to perform some operations remotely, people still opt for the face-to-face communication. Mainly it is related with the age group of the people because the majority of the project participants are older women, as you even can see from this picture. So 22% would still prefer to address their information requests or feedback and complaints through the hotline. What it meant for us, these findings, they necessitate the continuous training and awareness raising of the field staff on the process of recording the feedback and complaints received from the people, and also sharing the information, how the system works in the mission and how the organizational procedures function on the AAP and in particular complaints handling. Let's move on to the next mission. This example is from PH mission in Yemen. So building from scratch with community engagement. This mission is the youngest one. So the AAP system here was built from the scratch. But when the mission was set up, PH has already collected some valuable lessons learned from other contexts. And they were applied to designing the CPRM system there. One of the priorities implemented in the mission was to conduct community consultations about the preferences on the channels and on the different, like channels and also places where the information materials should be placed. So it also helped to build the better trust between the stakeholders and PH, and it made the project implementation in the country smoother. These community consultations, as you can see also from the picture, are also used to identify the places where on-site complaints channels will be placed, such as complaints boxes. So beneficiaries are even asked, not beneficiaries, but in general, the community members are asked where they prefer to have this channel. Let's move on to the next group of the lessons learned, which is community sensitization on the complaints feedback response mechanism, out-of-box thinking. So as I mentioned in the beginning, there are numerous constraints that may prevent people from sharing the information with the organization and also voicing their complaints. So operating the AAP mechanisms and also complaints and feedback response mechanism is definitely dependent on the context of the operation, and some factors as literacy level, for example, which can be low in some countries of operations like Somalia, South Sudan, Yemen. Also, we should mind the security situation and the socioeconomic status of the people. Sometimes the additional constraint is lack of information campaign coverage, and definitely the restricted access to communities due to COVID-19 pandemic since 2020. So having identified and analyzed those constraints, our missions identified some various solutions that can be implemented to either reduce or mitigate these challenges. And these solutions are establishment of community-based complaints committee in Iraq, or some innovative approaches to information sharing in Somalia, which I will talk about a bit later, or increasing the frequency of the deployments to the field, specifically with the aim to sensitize the communities on the AAP mechanism, and in particular CPRM, and collect feedbacks in Somalia. So we'll talk about these solutions further ahead. Let's start with the example of Somalia. This country has even particular CPRM information provision strategy in place, which also identified different channels, both one-way and two-way communication channels with the beneficiaries, with the aim to reach higher number of community members with the quality information provision. And this picture, you can see one of the monthly deployments of the NIL team to the field location for the community sensitization on CPRM. This picture was already taken in 2021. As you can see, people are wearing masks. Some new solutions in Somalia, which is new, absolutely innovative technical solution, especially given all the constraints of the humanitarian operations in this country. The mission identified the opportunity of cooperation with the telecom company. It is a new technical solution with Hormuz Telecom company, and it is based on the customer relations management system. Apart from operating the multi-channel hotline to accept the feedback and complaints, this system also allows to send voice messages to a list of phone numbers of the beneficiaries that are uploaded to the system. These solutions can be used to different information campaign, including sharing of the information about the complaints feedback response mechanism. What is essential is that the system helps to track the statistics of a number of people who received this message, number of people who listened to it, who did not listen, or who, for example, listened to half of the message. So it helps to improve the targeting of the next campaign by reaching out to those people who did not receive the message. In Ukraine, the example of, okay, basically now we are moving to the third group of the lessons, which is provide accessible and diversified channels. It was already stated in other presentations that we need to ensure that all groups of population have access to the channels, and these channels are based on their preferences and are accessible. So in 2019 in Ukraine, we identified during the focus group discussion with older people that the feedback and complaints hotline was considered as not functional well enough to the needs of the beneficiaries. So we identified further that some community members simply didn't know the working hours of the hotline, of its purpose. Or sometimes they complained that staff member that they could not reach the hotline when they wanted. So we also identified that the staff member responsible for the hotline could not always answer the calls because the staff member was responsible for other activities like field visits or other meal-related tasks. And for example, in some areas of our operations, their network did not allow the hotline to operate constantly. So based on these challenges, we identified some new solutions and implemented them in these missions. First of all, the visibility materials that are placed in the project locations, they were adapted to make more accessible for the older people and people with disabilities, like accessible formats. They were also placed in different places apart from the project sites, places where community tend to use frequently, for example, markets or some shops in the center of the villages. Also, we developed the multi-channel hotline with 2 people responsible for its operations, backing each other up. And finally, this, similar to Somalia, there is a CRM-based system that can also track and record all the calls despite the time of the call. In the end, what we have better informed and more satisfied people.
Yeah, sorry, could you wrap up?
Yes, I will wrap up. Just one slide from Yemen. It shows that the mechanism was adapted according to the needs. So you see it was already redesigned to include some stationery to provide people with opportunities to share their feedbacks. In Iraq, the complaints, community-based complaints committee was established. And finally, some good practices for managing complaints in timely, fair, and appropriate manner. So we think we are assured that management buy-in is also very important to build the feedback culture in the organization. Also, we should train the staff not only in tools, but in the big picture of the ECON to build the affected people so they understand why the sections are implemented. Different communication channels should be used, and the follow-up process should be well documented and tracked. Then also timely response to the people reaching out to us should be provided, and the effectiveness of the system should be measured, because complaints and feedback are a gift for the organization. And the final slide is the measuring of the results of the effectiveness of the system. We implement a few solutions. First of all, the related indicators to AAP, which is tracked on the stage, starting from the stage of the project design. Continuous data collection, not only in the end of the project, and different types of data, and also quarterly reporting from the missions to HQ. And a very simple solution that we have is the dashboard that illustrates the complex feedback mechanism. All these lessons and solutions help us to provide more accountable and high quality humanitarian aid.
So,
thank you.
Yeah, thank you very much, Lilia. I would just like to inform all our attendees that those three presentations will be available afterwards on the internet site of the Development Studies Association Ireland. And I would like to ask Dr. Susan Murphy, who is a lecturer in development practice with Trinity College Dublin. She's known for being an engaged researcher, as she's working with practitioners and policymakers, and this is exactly why we have invited her to join us to kick off the discussion by presenting her own thoughts about the presentations we just heard. The floor is yours, Susan.
Thanks so much, Galia. Thanks so much for the invitation to be here today. I would like to start, I suppose, by thanking our three speakers and the three organizations that you represent. I do think this is such an important conversation, and it's not a conversation that is widely held. It's so important that we understand, that we learn about what is actually done in practice on the ground in order to engage with communities, to gather feedback from communities, and indeed to be accountable to communities for the projects that are run. And there's a huge work going on, and as all of you have pointed out, going on over many years to engage with communities and find smart ways of interacting. I think it's really interesting to listen to the three different models, the three different approaches that have been taken by these different organizations. But there are some elements of similarity, I think, between the models and the approaches. I think in terms of community consultation around the processes and the need to understand what will work best with communities, I think that came through in all of the three models that we listened to today. The need for learning and sharing across organizations also, I think, came through in all of the three discussions today. And then thinking about, how to communicate with communities and beneficiaries, and thinking about how to communicate ideas and ideals and values around accountability to field staff also came across, I think, in the conversations today. But one of the things I would say is, I think, and it's my job, I think, to be a little bit provocative. And so I very much welcome your thoughts here. But I think one of the things that comes across very strongly is a very heavy focus on technical solutions. And there is no doubt that technical solutions are necessary and required. But we also know that these, there are strong political and social dynamics at play in each context that also need to be considered. And I would like to probe a little bit more on that side. And I think one of the things that really, I suppose, an entry point for me into reflection on accountability to affected populations very much comes out of some of the work following the safeguarding crisis, which hit Oxfam in 2018, which refers to a crisis in Haiti in 2011. and the Independent Commission report that followed. And in the Independent Commission report, large numbers of communities were engaged with, well beyond those who directly engaged with Oxfam. The Independent Commission actually took a very, very broad mandate and interviewed participants and beneficiaries and community members right from a very, very wide audience. And one of the messages that came across quite clearly was, I suppose, two messages that emerged very clearly from that review and really helpful report. The first one, I think, very much relates to for many community members in a humanitarian context, there are so many different actors at play that sometimes it's difficult for people to remember who and what, actually, they have an issue, gave rise to a particular issue, gave rise to a particular concern. So what happens, for example, through the operations of GOAL, what happens through the operations of the medical communities very much affects every other actor in the space. And so I think the general call from this group to share and to coordinate and collaborate is absolutely critical, because for many communities, there are so many actors on the ground, so many actors asking for complaints and feedback, that the need for consolidation and the need for sharing and the need for coordination is really very high. And I think that came through very clearly in the Independent Commission report. The second element that came through in the Independent Commission report very much also referred to organizational systems and ethos that could facilitate circumstances and misuse of power, essentially, in those spaces. And indeed, the recognition that power asymmetries and power dynamics are very evident and active in humanitarian spaces in particular, very much emerged through this report. And so I suppose, to begin with and to begin some questioning, I would, everybody here today has talked a little bit about beneficiaries and talked about communities. And I think recognizing the distinction and the need to engage directly with those who are directly receiving, as well as the wider communities who are affected by the actions, by our actions in such spaces is absolutely essential. But recognizing that beneficiaries and communities are not homogenous groups, it will be really interesting to learn a little bit more about how you interact and engage with different cohorts and different diverse groups and more marginalized groups in particular within the populations that you reach out to and with whom you engage as part of your feedback mechanisms, as part of your complaints mechanisms, and as part of your consultation mechanisms and community mechanisms. I think the second element relates to knowledge and information asymmetries. And this works in a number of ways in humanitarian settings. It works across organizations, within organizations, and also indeed within communities. And so understanding some more around those, how indeed your organizations address those knowledge and information asymmetries and seek indeed to reduce any power imbalances that may emerge from those spaces, I think will be really, really interesting. I think thirdly, reflecting on the epistemic capacities of communities. So I'm going to be asking a few questions around what it is you do with the data when you collect it. How do you translate this data into learning in a very practical sense, in a technical sense, and how do programs adjust as a consequence? Not only in relation to the technical delivery of specific solutions. So I've seen feedback mechanisms used really effectively in water and sanitation projects, for example, where community members will come forward and identify if there's leaks or there's problems and things need to be changed. And that, I think, it links in with Philip's point around changing from tuna to sardines to have better understandings of community perspectives. But I think also it's that wider learning around how do organizations take that back in, how do they reflect upon that with their staff, how do they reflect upon that back with their partners, and how indeed do they act in that way and bring an ethos of inclusivity, of respect, of listening back out to communities. So I'd love to hear a little bit more about that in particular. And I suppose to kind of frame the questions, if I can, I frame the questions that I'd like to start with, and I'm sure our audience have a wide variety of really interesting questions as well, but I'd like to frame them around four key questions that I'd invite each of you to engage with us in a discussion around. And the first one is really to share a little bit more about the learning and what you do with this learning. And specifically learning not only around the kind of the intended effects, but the unintended effects. And this to me comes with the wider community engagement rather than only beneficiary engagement, although beneficiary engagement is obviously critical, but that wider engagement as well and potential spillover effects of activities that, again, we as organizations operating in spaces are responsible for and therefore need to be accountable for. I think secondly, I'd like to hear a little bit more around staff training and partner training, specifically in around their own values, their own biases that they bring to their work, and indeed their own understandings of accountability and how it is you manage those processes. I think thirdly, I'd love to hear a little bit more about the underlying systems. So everybody's talked really well about how data is collected, and I'd love to understand how is it managed, how is it analysed, how does this feed back in then to, and I know that this fits in very much with the monitoring, evaluation and learning communities, but listening to a little bit more around how it is you manage that data and how your systems actually manage that data. And Lilia, I think you've presented some really interesting technical solutions around that. So I'd love to hear a little bit more about that, how that gets then translated into the practice of the organization. And then finally, the question around leaving no one behind. So again, ensuring no one is left behind. So everybody has spoken about how there's outreach into communities to inform them of these opportunities, to provide complaints, to provide feedback, and to indeed share their thoughts and perspectives on the supports that are being made available. But I think there's a very big difference between talking to people and talking with people. And so I'd like to understand how it is you actually have that two-way dialogue, and indeed how it is you reach those groups that are more marginalized, less likely to come forward. And it may be for accessibility reasons, or indeed it may be for other reasons related to social status and social dynamics and so on. So how do you reach into those spaces and ensure that those voices can also be collected, be gathered, and be reflected upon and considered then back into the practice as you continue with this essential work. So I hope they're a helpful start to the discussion and the conversation. And I would like to thank you all again for sharing what I think is a really, really important and interesting set of really important technical solutions around building accountability systems and structures. And I suppose my question is, how do we take those systems and structures into ethos and practice such that communities can actually feel very much part of the process rather than necessarily feeling somewhat excluded by that. So I hope that helps. Thanks, Galia. Back to you, Chair.
Thank you very much, Susan. I would just like to indicate to our attendees whom we do not see, but you see us. So please indicate if you would like to ask a question in the chat so I can enable you join us with video and audio. And before I let our speakers respond to Susan's questions, I would just like to add one issue. I wonder whether from the perspective of the of Małgorzata and Lilia, whether the fact that Poland and Ukraine, for that matter, have also the experience of being on the partner side, on the beneficiary side, does this is it a factor that is making AAP easier when you're on the side of the donor? So I guess I'll give the floor now to Lilia to start first by responding to Susan.
If I understand your question correctly, you mean the fact that the organization comes from Poland makes, because the sound was not very good, to be very honest.
Oh, sorry. So my question was whether well, you're obviously younger than I am, than my generation, so you might not have first-hand experience in this, but Polish organizations, including Polish humanitarian organizations, have also had the experience because Poland, as a recipient of official aid, so has been on the side of the recipient. And is it a factor now that those organizations are on the donor side by delivering humanitarian assistance themselves?
I think, yes, this perspective is very important. But what I want to say is that, again, according even to the history of our organization and to the observations back then I was not participating in this process for the obvious reasons. But what I know is that this kind of action that was initiated by Janina Hojska in 1992, it empowered the Polish society and gave this unique opportunity to be already on the other side of the humanitarian action, not on the side of the beneficiaries, but on the side of the people who can actually contribute to reducing the vulnerabilities of people in other countries. Yes, I think it was a very important boost for the Polish society. I see Mr. Grutza joining.
Yeah.
Yes. Hi, can you hear me?
Yeah.
Well, basically what Lilia said is PAH at the very beginning was a recipient organization. At that time, it was still called, it was a branch of the French organization called ECLIB. So the first activities were to disperse goods coming from France, from various countries in Europe. So we were handing out medicines, clothes, and that what was the beginning. So definitely, I mean, my generation, let's put it that way, has this we remember being recipient, and to be quite honest, we didn't have a complaint mechanism in place. So it was definitely different, but still you can easily still remember how it is to be the beneficiary, not the one who is handing out the aid. And it makes a great difference. Yes, Susan, you're right.
Yeah. If any of the speakers would also address some of the issues raised by Susan, then just, I guess, just take the floor.
Yes, I would like to meet Susan's questions regarding how do we implement lessons learned into our future actions regarding complaint and response mechanism. And I may talk about Tanzania. That is a very good example of that. We learned from our outreach team and social worker working in the field about problems with the GBV within the rural households, about women abused, children abused, women raped and tear out of the house. So we decided to start the huge component of our current project in that area. And we employed a lawyer, a woman, who is also the legal advisor to the women in the rural areas. She's employed in permanent contract for next few months. She started in January, and she's available to all women in the office that we are renting for her in close to the hospital, because our partner in the area is the big hospital there. And she realized that the problem is not only in the rural areas, because she's joining our outreach team and mobile clinic, going to the field once a week, but there is a huge problem also inside the hospital staff, because women who are employed in the hospital, the medical staff of different levels, approach her in her office seeking for advice, also seeking for some mediations within the family issues, within the marriage issues. So we decided to expand the project, and we started to conduct trainings for women group leaders in the area. Our goal is to train 45 female leaders within the rural region, and already the first training took place, and I was there in March to see and to to attend. Maybe not attend, but just to watch, because the training was in Swahili, so I couldn't understand, but I just wanted to see the methods and the the attitudes and approach of our legal advisor, and I was really surprised, and I was pleased to see how that really brilliant woman is handling the training for rural women that are, of course, leaders. So it means they are chosen to the position by other women within the community, and how what ability she has to engage them into discussions, case studies, problem solving. And then those 45 women are obliged to go to the communities when they are coming from to pass the knowledge to other female friends and local women and men as well. So it is sort of the cascade training, but it works, and we can see that response and feedback system that is basing on our legal advisor that is permanently there is working very, very good. So we can base on monthly assessment and monthly report of our lawyer, and we can adjust the actions according to her findings. And we were really shocked in the first reports from January that showed that the GBV in the rural area is much broader and bigger issue than we thought. So we decided together with our legal advisor to expand the program for trainings and also to include her visits to the field with whole trips of our mobile clinic and outreach team. So we'll see at the end, within our final evaluation, what were the outcomes of our really quite well-structured answer to the needs regarding GBV, and also inclusion, also including women rights, also about menstruation rights, also about schooling for girls. It's a very comprehensive approach. So yeah, we will publish our findings at the end of the project, but I am really looking forward for that.
Thank you very much. I would like also now to give the floor to Ludwika Kleinowska, who has joined us, who wants to ask a question. Can you unmute yourself, Ludwika? Hello, yeah. We don't hear you. I don't hear you at least.
Oh, sorry. It's now better?
Hello? Yeah, it's better now, yeah.
Okay, thanks. So my name is Ludwika Kleinowska. I'm from Polish Humanitarian Action. And I'd like to ask Philip a question. You mentioned that Goal joined the CHS Alliance. So I'd like to ask you whether it was a good decision. Are you happy with that cooperation, and how did it contribute to establishing or improving the standards for AAP? Thanks.
Thank you, Ludwika, and I'm very happy to answer that question. And I hope people can hear me okay, because I know there's been some problems. Yeah, so look, the core humanitarian standards are what Gold consider to be our primary quality, assurance model, and we take a lot of effort in very heavily training our staff across all of our country programs and in the past in head office on the actual standards themselves, and that's staff not just involved in meal or accountability or safeguarding, but across the board. And we're overdue a head office, I think, training, which I wanted to do last year, hoping to do as soon as I can go back to Ireland. But yeah, in terms of membership of the Alliance, I think it's beneficial. It's up to each agency to decide, obviously, that there is obviously a cost as well of membership, but we are engaged with the CHS Alliance, not just from my own portfolio, but across different levels of the organization. So currently they have a number of different best practice working group, and I don't want to sound like I'm an advertisement for the CHS Alliance, I don't work for them, but they have a number of working groups and communities of practice across different areas, because of course we're here today talking about accountability to affected populations, which is a very specific, I think, term, but accountability is a much broader, school. in our sector. It covers finance, it covers HR, it covers, you know, the acceptable use of the environment and logistics and procurement. So it's, I think, it has importance across the board. And we found with the Alliance, we are engaged with them in serious complaints investigations, communities of practice, safeguarding working groups, HR communities of practice in terms of, you know, the management of staff, as well as accountability to affected populations. They also, you know, provide a system whereby an agency can undergo full verification. We haven't done that yet ourselves. We've taken parts of it for our benefit, and that's been quite helpful. So they have also been helpful with linking us up with other agencies. For example, when we were going through a name change from the complaints response mechanism to the community feedback mechanism, we did elicit the CHS Alliance to help us, you know, get some best practice from the community. So on the whole, I would say it's been very positive. I think that the other thing I would say, though, is I think there's an increasing amount of working groups, communities of practice, things that are popping up all over the place on AAP. There's a bunch of results groups, and I think there are a few that have been popping up over the last year or two, and that's very beneficial. I think it'll be great to coordinate them all a bit better, but I think that there is a growing community out there, but I think the CHS Alliance have been, yeah, very helpful for us. I hope that answers your question.
Thank you.
Yes, thank you.
Yeah, perhaps I should give now the floor to Lilia to respond to Susan's questions. And I must say that I myself am very interested in your feedback on the unintended as well as the intended consequences of humanitarian interventions that relate to AAP. That was one of the issues that Susan also raised.
Okay, I'll try to be brief. In terms of the managing the data and using it for the decision-making purposes, all stages are really important. First of all, as I already mentioned in the presentation, it's important to explain that not only tools matter, but in each level, starting from the field-based employees to the management of the country offices, people should understand why we are using these tools, what is the purpose. In terms of the communication, the format is important. Although we understand that currently there are limited opportunities for the face-to-face trainings, face-to-face awareness session, we should go online with that. But the more accessible the format of the information you present is in accessible format, understandable way, and plus it should also provoke some thinking for the staff that is the recipient of this information. So it's very important to strive to think out of box how to present these mechanisms in a very, very accessible way for the people to understand. So this is the first thing. The second thing, how the data is collected, whether timely it is collected or not, and timely analyzed or not really matters. If you have nice data with lots of findings, but it is collected in a not timely, you will not be able to make a use of it. That's why in our, for example, managing the feedback and complaints data, we tend to use different options, basically different channels. We do not wait until the week is over or the month is over, for example, to present this data. We disaggregate based on the importance of this feedback. We disaggregate this importance and then we share immediately some of the feedback. Some of the feedback can wait until the end of the week, let's say. I mean, just talking practically. And some of the feedback can be just presented in general during the, let's say, project review meetings. In PH, it is also important that we have different practices to ensure the decision making is done based on the feedback. One of the good practices that, and actually not even practice, but it's really now procedures and it's been implemented, is regular project review meetings where all the stakeholders sit together and discuss what was going wrong, what was going right, what do we have, what kind of data, evidence we have to support this and that, how can we use this data. So, and the staff usually motivated to participate in these discussions because the results are pretty visible afterwards. In terms of the technical solutions, yeah, so the data is collected on the country level and on the global level for sure. It's important to be able to present some of the findings on HQ level. It's not easy to collect it, so we do not collect all the scope of the information. We collect the most crucial indicators from the AAP that are then aggregated on the global level. And how it helps, for example, very simple indicator, number of some feedbacks that require follow-up actions that were actually taken into account. It's very simple indicator that shows how effective the system is. And even for the last year, I can say that in 2020, let's say the percentage was, for example, 50–60%, but then now in 2021, it's increasing to 70–80% of the feedback actually used in the action. It's not always possible, unfortunately, to use all the feedback for the decision making. There are some constraints related to the context, but the more we try, the better results we have.
Thank you. I wonder whether any of you, including Susan, our presenters today, would you say that AAP is more measurable, more easily operationable in humanitarian rather than development assistance context?
I'd be interested to see if my colleagues differ, but no, I don't think so. Actually, I think that while some of the operationalization is different, I think that ultimately the measurement is the same, and what you're trying to measure is often the same. The needs are obviously different, context is different, but I would say it's both as easy and difficult to measure in either context, and because ultimately I think we are effectively trying to measure the same things. So I wouldn't see a huge difference there. No. In practice, yes, but in measurement, no, in my experience.
I would support this idea. It doesn't really depend on the type of the operations, but it highly depends also on the accessibility and accessibility to the affected communities. Because some areas of PH operations are hard to reach, and due to different reasons. It can be reasons for security, it can be a bit political reasons of the type of the acceptance of the local authorities, for example. So whereas in some countries and in some places you can easily organize the discussion, open discussion with the community, or you can collect the data through various methods. In other places you simply cannot. And definitely it affects the measurement, it limits the scope of data that you collect, and definitely then the scope of the decisions that you can make based on these findings.
Okay,
Yes, and within humanitarian aid context, within the natural disasters or military conflicts, you have really very limited time for rapid needs assessment. And also when you do not coordinate that with other actors and stakeholders on the ground, then you go for some chaotic research. So it's always better to do joint needs assessment when you coordinate on the cluster level, who is doing what and approaching which group of beneficiaries, which location, and also you agree on the service content, and then you have a valuable needs assessment report, then you can base on projecting your actions. But humanitarian aid context is really like challenging in terms, as Lilia has said, access to location and time, because time is very important. So you really have like 24, 48 hours for the rapid needs assessment to start action and to start helping affected population. That is really, really limited and challenging.
Yeah. Susan, if you have
I mean, I think so. I absolutely listen to our practitioner experts here who know much better in terms of their own experiences and their own organizations. But I do think the research does indicate, as Philip has made the point, you know, one isn't necessarily easier than the other. They're very, very different contexts and tend to operate in quite different ways. But I definitely think from a development perspective, as organizations are typically and traditionally involved over extended periods of time with populations and communities, you have that opportunity to develop relationships, to build trust, to really understand the context, to link in with partners, and to be able to communicate and to be able to engage, over time that you simply don't have in a humanitarian context. I also think the number of actors and the number of agencies in a humanitarian context is quite different, and the types of activities that agencies engage in may be quite different. And so that can bring its own opportunity, but also its own complexity for affected populations. So I think it's quite different, but certainly in the development context, most organizations are engaging over extended periods of time, and so they have time to build trust, to develop links and networks, and actually to reach into much more deeply, I think, into communities that simply quite often that time is not available in humanitarian context. It is an extended fragile context, but it's not necessarily available. And I know Gold, for example, would be engaged over extended periods in fragile contexts, and so probably has had that time to build that trust, but in more immediate settings, that timing isn't necessarily available to do that, which creates its own challenges.
Yeah, so thank you very much. I can see we are already, the webinar has already taken 90 minutes, so as much as we have planned. Oh, I must say that I personally have a lot of food for thought, so which I think actually indicates the success of this our webinar, that upon finishing it, there are other issues that, well, at least me personally, I would like to know more about. I would like to thank very much our presenters. I'm very happy for this common international undertaking. Thank you very much also, Susan, for joining us. And to all our attendees, for those of us who are not yet members of Development Studies Association Ireland, which is a community, a unique community, I would say, of practitioners and academics, and it is very international, as you can see. Just consider joining. It's free of charge. And there are also other groups, not only the civil society study group, that are part of the organization, and we'll be happy to have you also in our future webinars. So thank you very much. Stay safe, and I hope to see you around on webinars for the time being. So thank you.
Thank you very much, Galia. Thank you.
Thank you, Galia, for organizing.
Thank you for.
Thanks all.
Thank you. Bye.
Bye.
Bye-bye. Thank you. Bye-bye.
Thank you. Bye.